Welcome to the sixth video of this series about curriculum development in health profession education. The main aim of these videos is to support postgraduate health profession education at master and PhD level, as well as faculty members who are involved in the curriculum development. My name is Mohamed Hassan Taha. I am medical educationist with the passion of advancing medical education to improve the population health. Today's video will be about curriculum development in health profession education. And I highly encourage you to watch the previous 5 videos in this series, which is related to overview of the curriculum approach and philosophy, learning environment, the concept of hidden curriculum, outcome-based education, and writing learning outcome. Let us start our today video. This video will discuss curriculum development in health profession education. This video has been developed, and this session has been developed based on 6-step approach in development of the curriculum. Here, the 6-step approach: identifying the problem and the general needs, then targeting need assessment, goal and objective, educational strategies, implementation, and then evaluation and feedback. And it's available in the book Curriculum Development for Medical Education 6-Step Approach. Okay, let us start with the first step: identifying the problems and general needs. We have several measures that we can use to identify the problems and the general needs. Starting with focus group discussion, nominal group technique, using Delphi technique, critical incident surveys, studies of error in practice, task analysis, interview with recent graduates, as well as study of the existing curricula as benchmarking. Following the identification of the problem and the general need assessment, then we'll go to the targeting need assessment of the learner and the targeting need assessment of the learners. We need to establish a rationale of the curriculum or a course. So what is the statement of the problem? What are the health problems and the needs of the learners related to this curriculum or course? What is the cause of this problem, and how the learners, what are the competencies needs for these learners to solve these problems, and why this course as a solution for these problems? So for the learner needs, we have to consider the learner needs, the community needs, and also the professional needs. Following identification of the problem and general needs, targeting need assessment. Now let's see the goals and the objective or the competency. And if you can see here the screen, the goals and the objective, and this is related basically to the knowledge, skills, and attitude, and which shape the competencies and measure through the entrustable professional activities. And as you can see here, all these are close with integrated and with each others. So identifying the general needs, targeting need assessment, goals and objective. Let's move to educational strategies that will be considered in the curriculum. And it's very important to consider the different strategies that we can use and to assess where our program is positioned in each of these of the SPICY continuum. SPICY for student-centered, problem-based, integrated, curriculum-based, elective, and systematic. So where is our curriculum and where is our program? And we need to plan accordingly. And similarly, at the same time, we need to think about the content organization of the curriculum of the course. So a future healthcare practitioners will be able to apply principles of, for example, evidence-based medicine to determine the best practice to address the patient needs and so on. So we should have structured the course in a units, modules, X, Y, Z, and the learner need to learn it in a meaningful and digestible basis, because otherwise we'll end with curriculum overload. And this content need to be arranged in a systematic manner, and piece of the course need to be fit together. So here, example, the goal here, for example, having the goal here, a future resident or physician working in ambulatory clinic, or students who encounter patients with undifferentiated symptoms will manage the symptoms according to guidelines. And then we will do this organization in this way. Unit 1 will lead to this, Unit 2 will lead to this, and Unit 3 will lead to this. Okay, if the content I have specified for my course essential and up to date? This is a very important question that I should ask. Have I left out anything important? Have I included anything that is not important and could be deleted? So this is not individual task. This is the group activity or course team or course committee work. Then we need to do like the mapping, and we'll have a video about curriculum mapping, and we need to do the mapping so that we can make sure that everything we did everything is important, is existing in our course or curriculum, and nothing is left behind. And we'll find several ways of the content configurations. This some educators develop in this way, and it's not recommended, or maybe hierarchical, or maybe like this level called plume or linear or a spiral. A spiral integration, one of the best approach that can be applied in health professional education. And the next video will be about curriculum integration. So details will be there in that video. And then we need to do the content organizations, which level of the integration that will be considered in the curriculum. And again, this will be in the next video. Which instructional method that we should use to deliver the outcomes. And the ground rules here, we need to use different methods, multiple methods, so that to be aligned with the cognitive, psychomotor, and affective domains. And we need to consider the positive use of the technology. And here, and deciding the methods depend on the outcomes. The outcomes should guide us to decide which methods that need to be involved. So the step 1 is identify the problem and the general needs. Step 2, targeted need assessment. Step 3, goal and objective. Step 4, educational strategies. And step 5 is implementation. For the implementation here, let us see this approach. We need to map our session with the outcome of or the competency framework. And we need to move from competencies, outcomes to the session level. And cost is very important issue that need to be considered while for the implementation. And there are many factors also that need to be considered, such as the personnel, facilities, time, administrations, area, and so on. And when we're thinking about resource, we need to think about the human resource, the academic resource, and the physical resource that we have. It's very important also to plan for the assessment early, considering the type of the assessment of learning for learning and assessment as learning. And if we leave assessment at the end of the course, the learning will take place in this way. But if we have assessment like a programmatic assessment or have assessment at the interval, then because assessment drive learning, the learning will be in this way. And we need to think about what are the teaching and learning, what are the assessment methods that need to be considered. And in a specific series related to the assessment, we are going to describe these assessment methods that will be considered. Finally, for the evaluation and feedback, who should be included in the evaluation? Evaluation and the feedback, the learners, the faculty members, the other stakeholders, and most important, the community should be considered for the evaluation and the feedback. So we need to do the quality assurance for the course or the curriculum to make sure that working as a plan to identify area for improvement. And we should do it before the course, during the implementation, and at the end of the course. And we should use various methods such as observation, questionnaire, focus group discussion, interview, assessment of student results, and report. In a summary, the careful alignment of the need assessment, learning outcomes, teaching approach, and assessment methods and course evaluations are an inherent part of the course design and the curriculum design. And by following these steps, the educators are in the best possible position to create an environment for successful learning environment. Thank you so much for watching these videos, and looking forward to seeing you in the next video, which will be about integration in health professional education and in the curriculum. See you there.